So around 30 years ago, I was working with a friend of mine who was a doctor of chiropractic. His daughter had scoliosis, and it was pretty severe. They wanted to do surgery on her. So we started the standard scoliosis protocols for chiropractic, adjusting high side of the rainbows and things like this, and it just didn't work. We got her down a little bit, but everything, it was like hitting a brick wall, nothing changed. So for the next 17 years, we really studied and focused on scoliosis and understanding that scoliosis is a lot of abnormal biomechanics. And what that means is it doesn't function like a normal, regular spine would. For example, if I laterally flex to the left side, all the spinal muscles rotate to the right side. Well, in scoliosis, they rotate the opposite way. Now that's fascinating to me. I mean, why does it do that? And the reason is when we look at the spine like this, when I bend to the left side, the spinal cord has to go over the hill. But when they rotate to the inside, then the spinal cord goes through the valley. So the body's innate intelligence adapts in time and need to its environment, and the spinal cord's environment is the spinal canal, which has a lot to do with that. So once I start to understand how that functioned, I realized that if we could eliminate spinal cord tension, we get the spinous to start to rotate back to normal. And when the spinuses rotate, that the ribs follow that, and that's where the rib arch comes from, or the rib hump. Not my favorite word. So we call it a rib arch. But as the ribs follow that, that causes that spinal deformity. So we've been able to, by changing that, getting the efforts mechanical tension off, been able to help a lot of these kids cosmetically as well as avoiding surgery. And the doctor that I was working with, his daughter never did have to have surgery once we got this thing figured out. And now she's married and she has 2 kids and she's doing great.
That's great. What an amazing story. So what do you say to the other chiropractors and the other doctors that are on our platform about scoliosis?
Probably that the average chiropractor can't really treat scoliosis unless it's a very small curve. But I think rather than referring that patient to an orthopedic surgeon, recommend them to a clear doctor first. You know, the clear doctors have been trained with a 300-hour postgraduate program in scoliosis that we do through the Clear Scoliosis Institute. It's approved by Parker University out of Dallas, Texas for CEE. It's the only scoliosis class, curriculum that's actually has CE accreditation through a chiropractic college. The Clear Scoliosis Institute is a nonprofit institute, so we're not focused on the money, we're really focused on helping patients. And the other thing is that what we do is, as the clear doctors want to work together with the referring doctor, help co-manage that patient together. It's definitely a niche practice when it comes to scoliosis, and not every doctor wants to do that, but I think every doctor does want to work together for the benefit of their patient. So the idea is all working together, and this includes medical doctors, includes the orthopedic surgeons, working together for the benefit of the patient.
That's great. Thank you, Dr.